Welcome everybody. There's a ton of people here. Thanks, Bill. There's a ton of people here. Welcome everybody. We've got people from right around the globe online today, which is fantastic. So a big shout out to those people that are pulling some hours after work to be here. Really appreciate it. As I said, my name's Dr. Sharon Campbell. I'm a Senior Research Fellow here with the Menzies Institute for Medical Research and also aligned with the Centre for Safe Air. What I'm going to talk to you about today is a project that was a seed fund from the Centre for Safe Air. We also have some additional support from NHRA, Natural Hazards Research Australia, and the HEAL Network, which Healthy Environments and Lives Research Network. So today I'm going to talk about the project called Improving the Health of At-Risk Australians, co-designing a Bushfire Smoke Health Plan. There's going to be quite a bit of background info just to make sure everyone's on the same page. And then we'll go into exactly how we designed the plan. Okay, so hopefully everyone can see the next slide. I'm going to assume that until someone tells me otherwise. Some of this, many people online will already know if you're members or associates or affiliates with the Centre for Safe Air or you have an interest in pollution. But we know that PM 2.5, which is particulate matter with a diameter of 2.5 micrometers, so incredibly small particulate matter. It's a haze or a smoke that comes from bushfires, wood heaters and planned burns. And that's a known health hazard and has been for quite some time. There's lots and lots of studies from lots and lots of places all around the world that show that increased mortality and morbidity, so that's death and illness, from prolonged landscape fire smoke events. And that prolonged is a very stretchy term. For some people, that can mean a few days or even a few hours of exposure, all the way through to, multiple days of exposure. The reason that it's a health hazard is that it travels deep into the airways. And we know that if we're outside in smoky air or polluted air and we take a breath, often we might have a cough. But those PM 2.5 particles, because they're so tiny, they travel into our lungs and they can cross into the bloodstream. And so what that means is it sets up a systemic inflammation right throughout our body. And so it tends to impact our respiratory system most, and then also our cardiovascular system, so our heart and our vessels, and that can set off a chain of events. So who's most at risk from these sorts of health harms? And like many environmental hazards, it tends to fall on a particular group of what we might call vulnerable people or priority populations or at-risk populations. All of those terms are a bit interchangeable here. The first one is the elderly, and I'm not necessarily here talking about people that are in their, late 80s or 90s. Typically, we start to see a bit of an increase for people over 65, which isn't necessarily even elderly in our current, societal context. But what's happening there is that, as people age, we get more insults, we get more inflammation to our bodies, and some of our systems start to become compromised. And so this extra smoke event is just one more set of insults to our body. At the other end of the scale, we have young people, so usually up to about 5 years old, including babies and toddlers. So those people at the other end of the spectrum, because their systems, their cardiovascular system, their respiratory system isn't necessarily fully developed yet. So when they get that extra insult, it's harder as well. Those that are pregnant and those with existing chronic medical conditions. So anything that affects your heart and your lungs, diabetes, and we're also starting to see mental health conditions being affected by this. There's emerging research on bone health being affected by prolonged smoke events and brain health. But the thing is, especially for some of these non-respiratory and non-lung related impacts, the health impacts aren't quite widely known, and that is a bit of a problem. Because when we have these events, if you're from one of those at-risk groups, you won't necessarily know to take some extra precautions. So no surprise to anyone, I'm quite sure here, climate change makes everything worse. So when we have more heat, we have longer and hotter and more fires, and that obviously produces more smoke. So we get longer and more extreme landscape fire smoke events. There was a study, very recent study in the US that estimated an additional over 70,000 deaths per year by 2050 because of landscape fire smoke events. And that's a 73% increase relative to the previous 2011 to 2020. And there's a really interesting line in this paper that says our research suggests that the health impacts of climate-driven wildfire smoke could be among the most important and costly consequences of a warming climate in the US, which is a pretty amazing statement there. Okay, so there we go. Okay, the other thing to note about fire is that although the fire front might be quite small, so a few kilometres or even a few hundred kilometres in a bigger fire, it does affect relatively few people. Obviously, it's affecting the firefighters that are right on the extremes and at the fire front. But in terms of the fire front actually affecting people, it's a relatively small number. But smoke is widely dispersed. It travels a really long way, and that means it affects many, many more people. So the smoke that you can see from a fire might be hundreds of kilometres away. And so you're not directly affected by the fire in any way whatsoever, but the smoke is actually in an area where you're breathing it in and you're being exposed to that, and therefore you might be at risk. So a good example here is if we cast our mind back to the terrible 2019-2020 Southeast Australian fires, there were 33 deaths directly as a result of those fires, which is terrible. And Fay and team, I think Nico is on the call as well, so he was involved in this. There was an estimation and modelling done of over 400 additional deaths related to the smoke exposure. So that's, if I did the maths quickly, that's like a 12 times more deaths related to smoke than related directly to the fire front. So in some cases, we know how to reduce our exposure, and there's lots of different ways to do this, but we need to know what they are. The first of those is we can stick something mechanical in between us and the smoke. So in reality, what that might look like is a filter. So we might have an air purifier or air cleaner with a filter that filters out smoke, and that's a HEPA filter. We might have different types of ventilation. In North America, they're called MERVs. And these tend to be, in households, in buildings, in schools, in offices, that sort of thing. So it makes the air inside cleaner than the air outside. We can also do that on a personal level. So we stick something over our mouth and nose that has that filter as well. And we're really familiar with those. They're face masks. And you can see one of those in the little picture in the top corner there. We know that communication actually helps people get to work out what's going on as well. So if there's apps or if there's public health warnings or alerts, then that helps people to prepare, and potentially they might decide, say, to move out of the area where the smoke's coming in, or go home or go inside, or, have some sort of response that means that their exposure is reduced. And finally, there's a lot of work happening in Australia and actually right around the world about things called clean air shelters. And so what these things are public buildings usually that have some sort of filter or ventilation where people can go and make those spaces comfortable and community oriented, and those places have better indoor air than outdoor air. There's a fabulous paper by Nigel Goodman, who I think is also online today. I'll put all the references for these papers at the end as well if you want to follow up some of those. But yeah, Nigel did a fantastic review, systematic review of interventions, and came out with a whole bunch of these. But the thing is, all of them take work, right? So you need to have prior planning, and deciding on the most suitable set of interventions to reduce your harm is really difficult for people if you're already faced with a lot of vulnerabilities and difficulties, and then you add a layer of fire smoke or threatening fire on top of that. It makes making decisions incredibly difficult. So any sort of prior planning that can help with that will actually protect your health significantly. So how can we empower those people that are most at risk at the time when they most need it? And is there tools available to assist during those prolonged smoke events? And can we develop them? And yes, we can, and we have, which is great. So we're going to now dive into what the Bushfire Smoke Plan actually looks like. There's a bit of a precedent here. And so you're probably all familiar with the Bushfire Survival Plans. So these are plans that are pushed out by all of the fire agencies right around Australia. They're a little bit different in each jurisdiction, but they're essentially very similar. And so a bushfire survival plan helps you work through what your options are if a bushfire is threatening your home. And I highly highly recommend everyone go and have a look at that if you haven't had a look at that in your own jurisdiction. And some of you would be very familiar with chronic condition action plans. So these are things like asthma action plans or angina action plans, anaphylaxis action plans. So when you're diagnosed with a chronic condition, what do you do when that condition starts to ramp up, and what can you do at different stages? So the Bushfire Smoke Health Plan is a little bit like a love child between a bushfire survival plan and a chronic condition action plan. So we co-designed a Bushfire Smoke Health Plan with 3 groups of people, and that was a really critical thing to do. We asked at-risk consumers who had lived experience, and that's incredibly important for getting the right balance and the right mix of a consumer-driven tool. We asked health professionals because obviously they have a great deal of knowledge of clinical settings and guidelines and protocols, and content experts. So we needed to make sure that we had accurate information in there as well. Okay, so what did we actually do? We used something called a design thinking framework. And this is what the design thinking framework actually looks like. And I probably make emphasis on the messy line at the bottom because that's kind of what it feels a little bit like. This is not a straightforward process as it might lead you to believe. So there's 6 stages: the discover stage, the define stage, the ideate, the prototype, the test and refine. And we're going to step through each of those stages. So the first one is the discover and the define stage. So the first thing we wanted to do was a literature review because there might be something else out there that's really useful that we can draw on. We also recruited 13 people from Tasmania into focus groups. We had 2 separate focus groups, and we drew those from people who were most at risk, so the people that were in that list right at the beginning. We also interviewed general practitioners or GPs in southern Tasmania, did face-to-face interviews with 5 of those that were knowledgeable and worked in areas where there was a high risk of bushfires and bushfire smoke. And Anna Gedram, who's part of our team and also on the call here, so she did an amazing job doing a thematic analysis and a coding of the transcripts of those focus groups and those interviews. And then what we did was integrate all of that information and really tried to delve into what was the most pertinent there. And that was the bit where we get to inform what the resource actually looks like. So we drafted a prototype of the Bushfire Smoke Health Plan, and this is the part that gets really messy because we had so much information, all this amazing rich information from the focus groups, rich information from our literature review, and really rich information from our GPs. And then, of course, everyone wants to have a say in what they want this Bushfire Smoke Plan to look like. So we had to integrate all of that information, and Bill, who's coordinating this call and a great science communicator and great graphic designer, he did a fantastic job on that too. Okay, so then what we did was we had our prototype. We distributed that prototype to all of our focus group attendees, and they provided feedback via a survey, which was fantastic. We updated the prototype based on their feedback, and then we distributed that prototype to GPs and our content experts. So we had people from a health literacy background, from public health background, and air quality specialists all look at that. So much input. And we integrated all of that into our final plan. Okay, so what did we actually find out? Well, we identified 4 dedicated smoke and health action plans. So 2 in Australia, 1 in Canada, and 1 in the US. There's lots and lots of asthma and anaphylaxis action plans and similar chronic conditions action plans out there. So, multiple versions of those. When we drilled down a little bit further, one of the Canadian ones, or the only Canadian one, and the Australian one were tailored plans, the sort of thing that we were doing. The other plans were really just information. It was like, these are the things you might want to do in a bushfire. But the Canadian one and the Australian one were the ones that we're really interested in. The Australian one was actually one that Bill and Penny Jones and I had developed a few years ago that was integrated into the Bushfires in Your Health short course. But it was really, it was probably good at the time because no one else had really done anything like that. So we had nothing else to draw from, but there was no evidence base to that. The Canadian one, I'm hoping that Emily's on the line here. So Emily from UBC and Sarah Henderson, I think, is also on the line from Canada as well. Welcome. So they have a fantastic one from the Centre for Lung Health that had been developed in Canada, and we worked with Emily to help develop our plan and draw what we could from ours. After we did our lit review, of course, this is always the case, Emily let us know that there was another one that had just been released in Washington, and I believe Mary's on the line as well. So thank you, Mary. And that's the Washington Wildfire Smoke Action Plan for Children with Asthma. So we're going to have a look at all of those other plans in a minute. So here, a very short minute. So here's actually the original Bushfire Smoke Health Plan that Bill and Penny and I developed some years ago. And, people that did the Bushfires in Your Health short course did use it. We had fairly good feedback from it, but we didn't have a lot of evidence for how that was actually going to work in practice. Here's the one from UBC, and this is actually a wildfire smoke and extreme heat action plan, so both of those. So we can see on the right-hand side there, we've got wildfire smoke at different categories and things that you need to do in those different categories, and then the same for extreme heat. When the temperature is this, then this is what I need to do. And then on the first page, lots and lots of QR codes, lots of phone numbers for additional support. So that's a fantastic resource that Emily has developed and distributed in British Columbia in Canada. This is the more recent one, the Washington Wildfire Smoke Action Plan for Children with Asthma. So again, lots of lovely graphics. The air quality index, which is different to what we use in Australia. We use the PM2.5 index. So the air quality index and all the different ratings and all the different things that you need to do in different categories. So that's only fairly recently been released, I understand. So what did we find out from our consumers? Luckily, we had a really diverse group. They were fantastic. So lots of different ages, different gender, locations, and risk factors. And that meant that we had a really rich conversation and really rich input. Overall, participants tended to not have a great deal of knowledge of the impacts of smoke beyond asthma. So there was a few people in our group, focus groups, that had asthma, and they were well aware of that because it's a very instant response. But when you delved into the conversation about cardiovascular disease or diabetes, there wasn't a lot of knowledge about those. No one had any written plan for extreme smoke events. Some people did have asthma action plans if they had diagnosed asthma, which is fantastic. And the participants identified lots of opportunities to make the plan practical, accessible, and useful for daily life. So thank you. Mental health came up as an issue quite a lot in our discussions with focus groups, and I think this is a really undercooked area, look, probably in health in general, but certainly in this context. So I've just got a few quotes here from some of our consumer groups. I haven't ever considered the difference between a bushfire that is at risk to our property and bushfire smoke. And that was what I alluded to early on, that the bushfire can be hundreds of kilometres away and absolutely no risk whatsoever, but your exposure to smoke is actually quite a big health risk. A lot of people didn't have bushfire smoke in their consciousness. It's sort of sitting way out on the extreme edge of my consciousness, and it's not a priority. And a few people, actually quite a lot of people, talked about early alerts that would be helpful, and that communication message as one of the interventions that Nigel's systematic review highlighted as well. So we had 5 interviews with GPs. What did we find out from them? Also with GPs, a generally low awareness of the issue because it's not a core priority. There's so many other things going on in GP land. you've got patients lining up, you've got waiting lists, you've got really small consultation times, and talking about something that is a plan for something in the future isn't necessarily a high priority when there's so many other things going on. All of the GPs highlighted that we needed to make whatever we developed integrate into existing software and systems. And that's actually one of the big challenges for us to get this plan out there. But there is an opportunity under chronic health management, and that's sort of a separate thing to in GP land, is that you might go to a GP and then to a chronic conditions planning nurse, and that bushfire smoke planning could be built into that. And we're also hoping that the primary health networks, through their health pathways program, they have a couple of pathways around preparing patients for disasters and post-disaster health. And those things are opportunities that we're looking for getting our plan into that health pathways system. So some of the quotes here, if I think about questions that have been asked by patients, they would be about how to manage the home environment, and probably mostly in relation to respiratory concerns and if they should do anything with the medication. So quite a limited amount of scope there. It's difficult to communicate smoke's long-term health impacts on things like cardiovascular disease, how inhalation one day or over time can remodel blood vessels or their airways, and they don't realise it's actually impacting them. So that's a really profound thing for a GP to say, that's actually difficult to communicate this. And again, mental health came up for GPs. We've got a responsibility to think about how we not only address the issue, but address the impact of the issue on mental health. Okay, so overall, health impacts really under-recognised both by those in the focus groups and by our health professionals, and that current smoke warning systems aren't sufficient. There's a lot of work going on in the background about smoke warning systems, so I don't want people to think that this is not an area that's being ignored. It's actually just a really difficult area to work on. One of the strengths of our project was integrating the insights from our consumers and our GPs. And so we bridged that gap between lived experience and some of those real world problems and the clinical practice and the health system integration. And so that's why we think we've got a really good tool, because we've got both sides of that coin. So here's our plan. And I'm going to run through each of the components of this plan first of all. So we have right up front your name, your doctor's name, and some of the medications or treatments that you've already got underway. So you might note in there that you've already got an asthma action plan, for example. You can fill this out on your own, or you can do it in conjunction with your GP. So, you know, you don't have to have a GP, or you can start it. You could start to fill this out and then get help from your GP to finish off some of the issues. So all of that upfront information there. The middle bit here is identifying if you're at risk. So if you tick any of those boxes, and they're all the people that we spoke about right at the beginning here, those that have asthma, those at the older end of the spectrum, the younger end of the spectrum, heart disease, diabetes, and that smoke triggers distress. We're really addressing here this anxiety and this mental health side of it. Any of those boxes triggered, then smoky air could be a health risk for you. So this is the first thing we need to work out, are you at risk? We needed to put some information in here about, you know, how to actually make this plan work. And this was a real challenge because we wanted to put this in as plain language as possible, but it's actually a relatively difficult and tricky thing to communicate, as we've heard from a few GPs. But the main take-home message there is the higher the PM2.5, the worse the air quality, and that reducing your smoke exposure even by a small amount is great for your health. We've got some links where you can go off there and look at Aerator, which is how you can check your local air quality. That's an app. And of course, there's other trusted sources of local air quality information, government sources, and there's a link to how you can find those as well. So this bit is probably the guts of the plan and the most important part of the plan, and we work through this bit by bit. The air might look a certain way, and the air quality category, and the air quality is in that category. And these are the things that I do for each of those categories. And it's up to you to tick what boxes are available to you and what boxes you feel comfortable doing. But you can do this well in advance and work towards some of the more complicated ones, if you like. So check air quality using a trusted local source. So we've got links to what they are just in the previous section. Monitor my health. Everyone can do that. Am I starting to feel a bit more wheezy? Do I feel a bit lightheaded? Is my heart racing a little bit? Those sorts of things. We do that all the time in a smoke event. Do things to help me stay relaxed and calm. So it might be just some breathing exercises or doing something simple like a little puzzle, doing some meditation, doing some mindfulness. So we can do that if we're starting to feel tense or stressed at any point through our landscape fire smoke event. When the air quality starts to move into the poor phase, we want to close our doors and windows, think about using a mask, and then creating a clean air shelter within our home. And there's information on that on the next page. We certainly might want to start doing less activity outside. So if we have a normal exercise routine, which is fantastic, can we do that inside? So inside a gym, for example, or can we do that inside our own home? And as things get more and more smoky, we might decide we want to stay inside and do less activity altogether. Now, this is for a short period of time. We're not saying you want to do less activity for a long period of time. Public health advocate here, health promotion advocate, we always want to do, activity as much as we can. But there's going to be times in life when it's not going to be helpful for us. The next one here, go to an air-conditioned building like a library if it's safe to do so, if that's not going to put you into danger, and bring your medication. And so those air-conditioned buildings, like a library, are those clean air shelters that we talked about. There might be some of those in your location as well. And through iterations of this plan, you might know that there's other things that work for you as well. So you might want to keep in contact with other people that are like you, for example, and find out what they're doing and how they're faring. Now, the thing about all of these is that these all come from NHealth guidelines, which are government guidelines that have been developed by public health practitioners all around the country. And those NHealth guidelines are on a website, but they're really not that accessible to regular consumers. So what we've really tried to do here is translate that document and put it into a way that people can actually use that information. Over on the next page, we've got our preparation and recovery steps. So what can I do before the bushfire? So there's a bunch of things that we can do, some more information on how to set up a clean air shelter in your home, and information on air purifiers and air filters. And that really important step of preparing my mind and body before the event. So taking care of my mental health, eating well and exercising regularly, and avoiding other polluted air. And then what can I do after the smoke has passed? As soon as we look at our local trusted sources of air quality information and we can see that it's moved into that good quality or below 12.5, we can open up the air and let it into our homes, because over time, your home might actually end up being more polluted inside than it is outside. And that's the thing with smoke events too, is that when the wind changes, you'll often get periods of good air quality, even in among the periods of bad air quality. So it's critical to keep looking at the air quality on your trusted source. If there's anything that doesn't feel right in terms of health, get in touch with your doctor and book an appointment, and then reflect, have a think about what happened during the smoke. What would you do differently? Is there anything that you want to chat to the people I live with or care for about how they might help you do things differently, or they might want to do things differently, and then go back and update your plan. Okay, so what you want to know is where I can find it. Bill will pop this link into the chat if he hasn't already, and the QR code, I'll pop that up at the end as well. So it is on the Centre for Safe Air website and it's available right now. So I'll pop that back up at the end. So next steps is, obviously we want to get this out to as many people as we possibly can. So if you're in a position to do that, please reach out to us or help circulate that. We're in the process of developing a paper about this project and submitting that. And in terms of future research, what we'd love to know is to track and evaluate how this plan is used, especially during those peak smoke events. And so we'll be looking to that in the future. Some references here for some of the key things. I can certainly share any of those if you're interested and you haven't had a chance to latch onto those. Thank you to everybody who's here, everybody who contributed. As I said, it was supported by seed funding from the Centre for Safe Air, with help from Natural Hazards Research Australia and the HEAL Network, and a massive shout out to all of our research participants who gave their time in the focus groups, the interviews, and their feedback. I'll pop that up for a second longer, and then we'll open the floor to questions. Back to Fay. Thank you.
Thanks very much, Sharon. A very nice step-by-step summary. So now we can open for questions, and we do have a bit of time. You can raise your hand and ask directly. If you go to the bottom of your screen, there's a love heart where it says react, and that's the way to find the hand icon to raise your hand. Or you can pop them in the chat, and we'll try and go through and answer those as best we can. And there's a question there while we're waiting for people to raise their hands. Or are we? Am I not seeing them actually? Let me just get...
I can't see any raised hands, but there are a few questions in the chat. So maybe, we've got one raised hand. Yep.
Okay. I can't quite see it, but whoever has raised your hand, please go ahead and ask
It's
a
Abby.
question.
Abby, jump in, Abby,
Hi,
please.
hi. Sorry, I thought there must have been hundreds of raised hands. I can't quite believe I get a first question. Hi, Sharon, that was amazing and brilliant. Just a couple of questions. Have you considered kind of service designing this plan into a kind of interaction, for example, between cultural community leaders back to the GPs, community centres? Because I know at the top of it, you've got keep this handy in summer, but of course people lose things and they're not handy. People don't go to websites. So there is another accessibility question in a sense in that way. And the reason I sort of know this in terms of service design is that we've done a bit of work on like advanced care directives and how GPs might facilitate people filling them out, have a conversation about complex bits of that, and decide together how they're going to keep in touch with that moving forward. So it is handy in summer or when they need it. So yeah, I just wondered if you've thought about that dimension of accessibility and whether there might be more of a kind of formalised protocol with GPs to add this, to those sorts of conversations in future.
Thanks, Abby. Fantastic question. And it sort of speaks to some of the challenges about distribution of the plan. So we're still in the really early stages of how we get this plan out to GPs, and all of the GPs that we interviewed really drilled down on the fact that making this plan part of their existing systems was a key step in getting this out there more fully. And so things like advanced care directives is a great example where you sit down with your GP and you walk it through. So we'd love to see that in the future, and we're investigating a whole bunch of different avenues on what that might look like. Whether it's integrated into software, for example, if it's available through the health pathways, if it's available through consumer groups like Asthma Australia, we're open to any of those ideas about how we can get that plan out there and integrate it into existing systems.
Awesome. And so just one quick follow-up with the air quality monitors, that advice about knowing the quality of the air in order to take actions like open the windows again, that suggests that there might be a bit of a product review happening, because we know that there's a big uptick in air quality monitors people use inside that they just buy. And I don't know if there's quality control over that or a Choice magazine review or, I just wondered if you'd done any work in that space or not, that's sort of out of your guardrails or...
I know there's people on this call that have a lot more information on that.
Okay,
I'll answer a bit and then I might, hopefully if they're still there, I'll flip to them. So there's what we call low-cost sensors, and there's a lot of low-cost sensors available, and Purple Air is one of the more common low-cost sensors. And so people can pop them onto their own home. And they're relatively easy to do. You just need electricity supply and a Wi-Fi network. And so we can pop those on, and they can feed into a much bigger map. And that gives people the sense that they can monitor it in their own home. But then the map gives you an overall view of what's happening in that area. So that the purple is probably one of the more common ones. In addition to that sensing network, we also have government sensors. And so they're fairly widely distributed, but they're expensive. And they take a lot to maintain and to run. And so they're much more accurate. In the really extreme events, accuracy is not as critical and I don't mean that lightly. I mean, if it's over 300, it's bad. It doesn't matter if it's 301 or 350, right? So the more monitors that we can have on the ground, the better we're going to be able to get note of those events more quickly and see the bigger picture. Now, I think Nigel Goodman might be on the online.
I might.
Or Faye, if you want to jump in and...
I was actually wondering, Sarah, you made a comment also about use of sensors indoors, and I might invite you to make some comments about that. Dr. Sarah Henderson,
Beautiful.
BC CDC Vancouver, who's done a huge amount of work in this space, and it would be great to get an international perspective anyway. Thanks. Sorry, Sarah, putting you on the spot.
Good morning for you folks, I guess. Good evening for me. Thank you for the opportunity. We increasingly recommend that people look to some of the commercial technologies that are available. This came on our radar when IKEA started selling indoor monitors for $10 that just kind of have a yellow green or a green yellow red system, and then they have a more sophisticated one as well. We tested some of these in our facility just very informally to ascertain that they do quite a good job relativistically. If concentrations are higher, the numbers go up. If they're lower, the numbers go down. We don't put a ton of confidence in the absolute values, but they are certainly better than no information.
Thanks.
That's fantastic. Thanks, Sarah. And there's a lot, but Sarah's put some extra information in the chat, which is really helpful as well. Thank you. There's a lot of stuff going on in the chat. I might just, Karen, sorry, I'll go to Karen. You've got your hand raised. Sorry, Faye, I've taken over your job.
You're doing it very well.
I'm just back to the previous person's question about how it's going to be distributed. I've worked with other organisations in different plans, and other than GPs, neighbourhood houses and various community centres and migrant resource centres are great. But that question put me in mind of a resource that I picked up. I was at the Resilient Australia Awards in Hobart, and the RSPCA had won an award for a kit that they had produced for how to keep your animals safe in a flood. Mm-hmm. And it was a great resource in that it was a Ziploc, solid plastic, like good quality plastic bag, and a magnet to your fridge. And it just made me think and it meant that it's always on your fridge. And when something goes wrong, we all know where it is. And it just made me think, like that one obviously had a Ziploc bag, so you can put all your relevant things in it. So then you're good to, if you need to evacuate, you're good to go. So it just made me think of what the previous lady, I can't see your name, sorry, what you were saying. And like if that exact plan that you've got, that one-page plan, if that was in a simplified, magnetized version on the fridge, then people could update it with a pen and rub bits out as they need and update when they want to. And it's right there in front of you all the time for the whole family.
Thanks, Karen. I think you're absolutely right. There's so many different ways that would lend themselves to having this information. And it's probably, I'm very happy to chat to you about this offline as well. I can see in the chat that someone's talked about having this accessible to culturally and linguistically diverse communities as well, and big tick there. Yeah, I think that would be fantastic to seek some extra funding to translate this resource into multiple languages. We've done that with some of the resources from the Bushfires and New Health short course, and that's been fantastic. So that would be a fantastic idea too. Yeah, I guess looking at, there's a proliferation of stickers on our fridges, isn't there? And, I've got the little bushfire emergency fire danger rating one. And yeah, so having something like this, or even that went to a QR code and a website that you could fill out, or an app, there's all of that sort of stuff is still to come in terms of distribution.
Thanks. While there are no hands, I might just read one or two questions from the chat. There was one earlier from Rachel. Are there proposals to ensure nationally consistent air quality parameters? And I can answer that. Australia's had a national air quality working group active for many years, and was a couple of years ago that nationally consistent categories with actions were endorsed, and they were updated again a year ago. And this was by NHealth, our Environmental Health Standing Subcommittee, who advise our health ministers through various committees. So we do have consistency, and most states are now showing those. Some are taking a bit of time to update their web pages, but we do have consistent parameters and consistent advice. And that was an outcome, a recommendation of our Royal Commission after our severe season of 2019-2020. There was another question, Sharon, have the results been published? You might want to comment on where that's up to.
Yeah, sure. So the project team is in the middle of, we're actually quite close to finalising the paper ready for submission. Submission takes quite a long time these days because it's really difficult to find reviewers. So I don't know the best way to let people know. Maybe we can just send an email to the folks on this list when it does become available, or it will certainly be available on the Centre for Safe Air website. So not yet is the short answer there.
Okay, I'll carry on. Annie, you had a question about any plans for developing and sharing communications plan with all the resources and copy and assets that go with it. Do you want to comment on that, Sharon? It's I guess the stage of the project, and
yeah, that's a good question, and it's sort of like the next stage of the project. We're funded to actually make something, and then to get the next bit out, and we've had some fantastic ideas here. So maybe I'm just trying to think of the best way forward here. Arnie, you might want to get in touch with the Centre for Safe Air and let us know. I'm not familiar with your name. I'm sorry. Other people from the Centre for Safe Air might know or be in contact with you. But if you can get in touch with that, Bill, if you can just pop the best email address, and we can, if you've got some great channels and networks, then we'd be really happy to involve those in the distribution. Yeah.
Thanks, Sharon. Now there's a question here about requirements for a clean air shelter. And I'm wondering who would like to respond to that. Some of the groups who've been working on this, possibly Nigel or Amanda, possibly Sarah. Is anyone would anyone like to make a comment? Australia doesn't have clear guidelines, but they're working on it. I understand that Canada does have guidelines. Is that correct, Sarah? Maybe you could comment for us here.
Sure, happy to comment again.
Oh, and Amanda's there too.
I think Amanda's here too, so she could probably comment on the Australian context. But there are guidelines for creating a cleaner air shelter in Canada, and then we should all be looking to the new ASHRAE guideline 44. Which is now in continuous maintenance. So Amanda and I are both part of that committee, and we'll be continuing to kind of update the guideline as we get more evidence on what works and what doesn't work.
Thank you. Amanda, would you like to add anything?
Yeah, just that I don't know if Donna Green is online, and I can see that Janice is. But yeah, we, through the NESP score program of work, we've been evaluating different buildings, and so looking at libraries, looking at schools, a shopping centre, and also working with new funding. We'll be working with some of the councils in Western Sydney and the ACT to sort of do some more evaluations of public buildings. So it's definitely a work in progress, and I think that there's a lot of interest, especially from New South Wales EPA. So hopefully in the near future we'll have some guidelines that we can send out to local councils that they can use to evaluate, how suitable a building is to become a safer air shelter.
Thank you. And Sarah's posted some of the Canadian guidelines there in the chat.
Thanks, folks.
That's fantastic. We've had some great discussion after a great presentation. I think we're winding up. Before we go, I'd like to firstly thank Sharon and the team, and we can possibly clap in the reactions box. And secondly, let you all know about next week's seminar, which is actually on the same theme, protecting people at higher risk from smoke. Tomorrow week at 12 o'clock Australian time, we'll have Associate Professor Supriya Matthew from the Northern Territory presenting on air quality in remote communities, Dr. Erin Walsh from ANU talking about a really interesting study she did on information needs relating to bushfire smoke of young Australians aged 15 to 19, and Sophie Oz from the University of Queensland will talk about firefighter health protective strategies. So that will be a very interesting and timely follow-up to today's seminar. As always, you can contact us through our website, and Bill has added a few links there, and you're welcome to join our newsletter distribution list if you would like to stay in touch with future seminars. And I might offer one last word to Sharon, and then we'll close today's event.
Thanks, Fay. Look, thank you so much, everyone. I love having these incredibly rich discussions. I really value our international perspective as well. So thank you so much for Sarah for jumping in. And there's a huge amount of resources on the chat. So let's just take the time to jump in and look at some of those, some international ones and some Australian ones as well, and lots of lovely ideas about distribution. So please get in touch with us through the email that Bill has posted there. Thank you again, and I look forward to hearing more from you about how we can make this resource useful for people in your community.
Wonderful.
Thanks so much.
Thank you, Sharon. Thank you, everyone, for coming, and we'll see you next week. Thanks. Good night. Thanks. Or good afternoon.